I want to share some of the things I learned about UV rays and skin cancer, vitamin D, and sunscreens. So let's get to it. So let's get started with UV rays. There's actually 3 types of UV rays that we get exposure to: UVA, B, and C. However, UVC rays are completely blocked out by the ozone layer, so that's not something we have to consider presently. So let's start with UVA rays. They are the ones that you blame for causing retinal damage and cataracts, so make sure to wear your sunglasses. They account for 90 to 95% of the total amount of UV radiation that we experience on Earth, which means that it's really important for you to use a fully broad spectrum sunscreen when you're going to be exposed to the sun. So UVA is present throughout the day. It's very consistent in intensity at different altitudes, and it's going to be present throughout different seasons. UVA actually does penetrate through glass, plastic, and also about 50 centimeters into the water. Make sure you have good sun protection at all times. Now let's go on to UVB rays. They account for about 5 to 10% of the total amount of UV radiation that we experience, and you experience higher intensity UVB rays at higher altitudes. So if you're climbing that mountain and it's a really high mountain, you need to make sure that you're very protected against UVB radiation. UVB is mainly hitting Earth during the summertime, and mainly at around 10 a.m. to 2 p.m. UVB is a radiation that causes you to create vitamin D. So regardless of what kind of UV radiation you're going to be exposed to, you're going to be at risk of premature aging, which means later on in life you might experience different textures in your skin, so wrinkles. For some people it might be hypo or hyperpigmentation. It could be areas of really dry skin. All UV radiation can cause skin cancer, can cause slight immunosuppression, so that means your immune system is not going to be functioning at its best. And delayed tanning occurs for both UVA and UVB rays. So in terms of tanning, some people talk about a base tan and how if they get a base tan they're going to be protected from sun damage, and that is completely untrue. So if you are going to be more tanned, or if you're a darker skin and you don't, you realize when you're tanned or if you have darker skin that you don't burn as easily, that doesn't necessarily mean that you're protected from potential skin cancer or damage to your tissue. So you still need to make sure that you have really good protection against the sun. And also make sure to wear sunglasses, because your eyes can also absorb sun rays as well. So depending on the time of the day and what season it is, the amount of UV exposure you're getting is not very consistent. So you could actually Google or use your other search engine if you're using something else, UV index, and see what the UV index is for your region at a specific date, like today or tomorrow. And then it'll give you a number from 0 onwards, upwards. I think it goes up to the 10s, the 15, around 15. And you could, if you're not sure what, high risk or very extremely high risk or low risk means, you could click the link below, and I've actually compiled my notes and shared my notes about what different UV indices mean for you and what you should be doing about it. Okay, so now let's talk about sunscreens causing cancer. So there's actually evidence that if you use sunscreen for the first 18 years of your life, you're going to be at a 80% decreased risk of any kind of skin cancer when you're growing up. So children need to wear sunscreen. Unless they're less than 6 months old, then chemical sunscreens are not going to be recommended in that case. But you could still use physical sunscreens because, for example, zinc oxide is really soothing, and that's basically your ingredient of diaper rash stuff. So I'm going to be having a video out about sunscreen ingredients as well, so you can check it out somewhere else. There's been studies proving that if you use sunscreens every single day for 4.5 years, you're going to have a decreased risk of squamous cell cancer. Your risk of having a new melanoma is decreased by 50%, and invasive melanomas are decreased by 73%. Melanoma is the hardest type of skin cancer to treat because a lot of different types of skin cancers it's very easy, you just excise it. But melanoma is really difficult to treat. So, that's very good, compelling evidence for me to wear sunscreens. Also, there's a lot of studies, apparently, out there that show that sunscreens can cause cancer, and that is completely untrue. There's very poorly conducted studies showing that sunscreen application causes cancer, and you should not believe them. So if you actually read some of the methods on how they conducted the studies, you'll realize that the group that is going to be wearing the sunscreen, they feel that they're completely covered, and as a result they're going to have more sun exposure, and they might not be applying their sunscreens at a regular interval, which is required for sunscreens to work. There's no compelling evidence that sunscreens cause any kind of risk, but there's a lot of evidence that is pushing towards sunscreens being protecting and helping people, preventing skin cancer. So that's why you should wear it. And lastly, some people are concerned about the issue with vitamin D and not having enough vitamin D because they're wearing sunscreen. So only a small amount of vitamin D is actually needed for your body, so you don't need to be exposed to the sun for such a large amount of time. Usually people say like 20 minutes of sun is good enough, but that's kind of controversial. So theoretically, your skin should provide you with about 90% of your total vitamin D requirements. However, in practice, the amount of vitamin D that you're actually making really varies, depends on how long you're being exposed to the sun, the amount of skin pigmentation you have, which area of body is being exposed to the sun. And the Institute of Medicine actually says that you should be taking the same vitamin D supplements regardless of which season it is in. And also there's some arguments saying that, sunscreens might not actually significantly affect vitamin D production in your skin. So I would say all in all, there's a lot of evidence against having unprotected exposure to the sun, but there is arguments against using sunscreens and not being protected. So if you're going to be concerned about your vitamin D production, you should really be supplementing it, or drinking more milk or other kind of dietary sources that contain more vitamin D, as opposed to being worried that having sunscreen on is going to be impairing your body's production of it. So thank you for watching. I'll see you in the next video. Bye bye.